32-year-old man presents to the clinic for intermittent epigastric pain for past 6 months, lethargy for past month. He denies any history of smoking or alcohol use. No significant family history. His blood pressure is 144/86. The pulse is 98. Respiration rate is 15, and on physical examination, patient looks pale. Laboratory findings are significant for hemoglobin of 10, leukocyte is 7,000, and MCV is 94. The urease breath test is negative. Endoscopy is performed and shows erythema in the body and fundus of stomach in the absence of any bleeding. There is hypertrophy of gastric antrum. Which of the following type plays greatest role in producing the antibody that causes this patient's presentation? With the answer, can you name what is the patient's condition or what is this patient is presenting with? Yes, so the plasma cells is a correct answer. Most of them give right answer. I think everyone gave right answer. But this patient is presenting with a type A chronic gastritis. Okay, patient is presenting with chronic gastritis or antibody mediated chronic gastritis. Remember, when we come from esophagus into the stomach, there are certain paths. So this is stomach anatomy, just rough anatomy. So here you can see this portion is near the heart, so it's called cardia. This area right here on the upper part, this is fundus, and this part right here is body, and last part or just before the pylorus, this part between the body and pylorus is antrum. So this patient is presenting. We have to remember what are the types of gastritis, and so this patient is presenting with what are the signs and symptoms. Let's look. So he's having mild intermittent chest pain, sorry, epigastric pain, and he denies any history of smoking and alcohol use. So there are two types of gastritis. The type B is related with NSAIDs use. H. pylori or any alcohol use related gastritis that is seen is type B, and the most common location for type B gastritis is antrum. While this patient is having antibody mediated, and you can see from the patient having low hemoglobin count, so this patient is having pernicious anemia. Pernicious anemia due to which vitamin deficiency? Vitamin B12 deficiency. And what is it missing? The antibodies against intrinsic factor. Okay, so this patient is having, so we can rule out type B by patient not having negative urease breath test, and the endoscopy shows erythema of the body and fundus of the stomach. So this is the part that was involved, and it is usually seen with type A gastritis. Yes. So let's go through the explanation. So chronic gastritis is due to chronic inflammation of stomach mucosa. So there are two types of underlying etiology. One of them is chronic autoimmune gastritis, and one is chronic H. pylori gastritis. Chronic autoimmune gastritis is due to autoimmune destruction of gastric parietal cells, and that is located in stomach, body, and fundus. Usually it's associated with antibodies to parietal cell and intrinsic factor, and this is useful in diagnosis. And this antibody is produced by B lymphocytes or mature B lymphocytes, that is called plasma cells. And the pathogenesis is mediated by T cells. The clinical features, there is atrophy of the mucosa, and we can see achlorohydria due to increased gastrin production. Patient might have megaloblastic anemia or pernicious anemia due to lack of intrinsic factor. There is a increased risk of adenocarcinoma, that is patient having intestinal type of carcinoma. So remember, the patient with chronic autoimmune gastritis, they are increased risk of having chronic adenocarcinoma type of cancer, while H. pylori is having mild lymphoma, mucosal associated lymphoid tissue lymphoma. So H. pylori is by H. pylori induced acute and chronic inflammation. H. pylori urease and proteases causes weakening of mucosal defenses, and the antrum is most common site. So B lymphocytes is immature B cells that is produced in bone marrow, undergoes immunoglobulin rearrangement to become naive B cell, and B cell activates by whenever there is antigen that is presented on the surface of IgM or IgD. This causes them to have IgM or IgD secreting plasma cells. So CD14 is a marker for macrophages and dendritic cell, and it's a part of innate immune system. Natural killer cells is usually seen with tumor and virus infected cells. CD4 plays important role in type 4 hypersensitivity, and that is T cell response.
Thanks for watching. Please give a thumbs up and subscribe for more.